Ibuprofen is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Be sure to check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking Advil, it's important to follow the directions on the package if it's an over-the-counter product, or to read the medication guide if it's been prescribed by your doctor. Take the medication by mouth with a full glass of water, and do not lie down for at least 10 minutes after taking it. If you experience stomach upset, you can take it with food, milk, or an antacid. The dosage of Advil is based on your medical condition and how you respond to the treatment. It's important to take it at the lowest effective dose for the shortest possible time to reduce the risk of side effects. If you are using it for a condition like arthritis, continue taking it as directed by your doctor. If Advil is being used by children, the dose is based on their weight, so make sure to read the package directions or consult a pharmacist or doctor for the proper dose. For some conditions, like arthritis, it may take up to 2 weeks of regular use to get the full benefit. If you are taking Advil as needed, remember that it works best when used at the first signs of pain. If your condition worsens or if you think you may have a serious medical problem, seek medical help right away. If you are using it to treat fever or pain and the symptoms worsen or last longer than expected, consult a doctor. Common side effects of taking Advil include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed Advil, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Advil may also cause an increase in blood pressure. It's important to monitor your blood pressure regularly and inform your doctor if the results are high. Seek immediate medical attention if you experience any serious side effects, such as easy bruising or bleeding, changes in hearing, mood changes, unexplained stiff neck, signs of kidney problems, vision changes, or symptoms of heart failure. In rare cases, Advil may cause serious liver disease. Get medical help right away if you experience symptoms such as persistent nausea or vomiting, loss of appetite, dark urine, stomach pain, or yellowing of the eyes or skin. Although rare, a serious allergic reaction to Advil may occur. Seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Nonsteroidal anti-inflammatory drugs, like Advil, may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while taking this drug but is more likely if you take it for a long time. The risk may be greater in older adults or if you have heart disease or increased risk for heart disease. Do not take this drug right before or after heart bypass surgery. This drug may rarely cause serious bleeding from the stomach or intestines. This effect can occur without warning at any time while taking this drug. Older adults may be at higher risk for this effect. Stop taking Advil and get medical help right away if you notice any of these rare but serious side effects: stomach/abdominal pain that doesn't go away, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, sudden vision changes. Talk to your doctor or pharmacist about the benefits and risks of taking this drug. Before taking Advil, make sure to let your doctor or pharmacist know if you have any allergies to ibuprofen, aspirin, or other NSAIDs, as this product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to inform them about your medical history, especially if you have conditions like asthma, blood disorders, heart disease, high blood pressure, liver disease, or throat/stomach/intestinal problems. Kidney problems can sometimes occur with the use of Advil, especially if you are dehydrated, have heart failure or kidney disease, are an older adult, or if you take certain medications. This medication may also cause dizziness or drowsiness and can make you more sensitive to the sun. Additionally, it's important to talk to your doctor if you are pregnant or planning to become pregnant, and to consult with your doctor before breastfeeding if you are using this medication. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Advil include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, and water pills, diuretics such as furosemide. This medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to check all prescription and non-prescription medicine labels carefully since many medications contain pain relievers/fever reducers, which are similar to ibuprofen and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless your doctor instructs you otherwise. But daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke, so talk to your doctor about using a different medication to treat pain/fever. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen. Take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Do not increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. If someone takes too much Advil and has serious symptoms like passing out or trouble breathing, they should call 911 or a poison control center immediately. U.S. residents can call 1-800-222-1222 and Canada residents can call their provincial poison control center. Symptoms of overdose may include severe stomach pain, trouble breathing, extreme drowsiness. If your doctor has given you this medication, don't give it to anyone else. You may need to have some medical tests while you're taking this medication, like checking your blood pressure and kidney function. Make sure to attend all your medical appointments. If you want to know more, ask your doctor. If you take Advil regularly and forget a dose, take it as soon as you remember. If it's almost time for the next dose, just skip the missed one. Don't take a double dose to make up for the missed one. It's important to store Advil at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it expires or is no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.